everyone. Welcome to the Glow Podcast. I'm here today with a very exciting guest. I have Josh from Surgery Stuff, and I'm super excited to speak with him. But for those of you who are new here, we are Tailored Marketing, and we partner with organizations in the health, wellness, and longevity space to fuel growth through strategic marketing and sales strategies. So if you are interested, drop a comment below. Josh, thank you so much for coming on. I'm super excited to speak with you. If you would, I would love if you would just go ahead and give a little bit of an introduction so the listeners know who you are.
Yeah. Taylor, really appreciate you letting me come on here and talk today and hopefully provide some insights into the area and also for all your help and everything that you provided for us. So, obviously, like Taylor said, my name's Josh. I've been in med device for over 20 years and sales longer than that. Started everything from capital sales to the disposables, working with hospitals with their GPOs, the IDNs, and a lot of the changes now within healthcare that we all experience for prices and the challenges that we get on supply chains and pressures that we're getting from all external components, along with the reduced reimbursements that the facilities that we work with are getting.
Yeah, no, that is really cool. And yeah, I would love to hear too, just like a little bit more. I know you mentioned obviously that cost is a huge thing in healthcare, and especially for like supplies and everything for the actual hospitals. And so I would love to hear just like a little bit more about Surgery Stuff and kind of how you all help with combating this.
Yeah. So obviously in every facility, physicians come and go. Centers are closing, they're adjusting their inventory, over-ordering, under-ordering. We work with facilities on their overstock to acquire that overstock they have that's in date, good condition, able to be used, just they don't have a need for. So we acquire it from those facilities, and we're able to go out to other centers across the country and provide those products back to those centers at a lower price. So it's great for recycling components because otherwise the hospital or surgery center would have to throw it away and they write it off, which no one wants to do. I had one center, they had over $1 million of inventory that they're like, what are we going to do with it? And
oh my gosh.
Huge waste at that point.
Yeah.
So we work with them to acquire a good amount of their inventory to bring it in for us. And then we're able to go back out to centers, and we have 1 year, 2 year, 3 year expirations on a lot of the stuff. And from that component, then the savings that those facilities see, we're able to be consistently supplying a lot of those items to them because we see them come in from the same facilities, same centers that are closing areas, and they're just higher volume. So we're targeting facilities literally of, we're not trying to change any of the physician's preferences. We're not training the staff differently. We're not going to come in with a new widget or gadget. We're coming to you and saying, hey, you're using widget A. I have widget A. I'm going to save you 20% of your contract price. And it's a very simple proposal we come to them with. Facilities obviously are a little skeptical because they're like, who are you? What are you? But when we put
they're like, how are you getting these prices?
There's definitely some of those questions that come across. Are these like in date? Are they good? I'm like, totally good. And so we do a lot with our insurance. We have a $3 million insurance policy behind us to insure all these products and make sure everything's settled. And just like everything in med device, we can't afford to have one bad day. Because if we have one bad day, obviously patients are hurt. We lose the trust of the facility, the surgeon, the staff. So on our side, it's very important to us that anything we put out there is even more trusted than from the manufacturer. The manufacturer can fall back on, oh, we didn't know, we'll fix it, take care. We don't have that luxury. So we really make sure everything we get is still good.
Yeah, no, that totally makes sense. And so I know you said that you guys basically take, so the like almost like leftovers, I guess, from like certain facilities for the medical devices. And so why are those facilities like not using them, I guess? Like, are they just like changing maybe their protocols, or like, can it be kind of a variety of different reasons?
Yeah, so I'm not going to use specific, industry names and stuff like that, but we all know some bigger names out there in the world. So one facility for their general procedures will use, XYZ, and they have a new surgeon group comes in. They're like, well, we only use ABC. So you're 6 months into the year, and that facility has acquired 6 months of supplies because it's in their warehouse, it's in their ORs, and the new surgeons refuse to use it. Wow. So it's kind of like, you want the new surgeons, you want that revenue, you want the patients, you want all the goods that come with that. And, just like any new employee, you want to make sure they're happy. So now this hospital has all this extra disposables that, what are they going to do with? So we work with them on that part to support that with them. But on top of that, sometimes new procedures come out, like you'll have a new version of a robot or a new version of this. And so an older version is not what that hospital wants to use, but other facilities still use that version. So we'll buy
Yeah.
that version and have it on stock for us for as they transition away, we can support them and help them with that part of it. And honestly, sometimes it's just somebody screwed up. Like they meant to order
Yeah.
10 eaches and they ordered 10 boxes.
Yeah.
Yeah, it's just like it's like you're going through and you're
Yeah.
entering it in and you're like, oh, oops. And so you have an option to try to return it, which then the manufacturer says, oh, we're going to charge you a 50% restocking fee, or tough luck, we don't
Yeah.
take it at all. To where we're like, let us help you, let us be
Yeah.
that partner for you. Not only can we buy that from you, but then we can support you on the other end for your other procedures and save you money.
Yeah. No, that totally makes sense. I mean, it's such a good idea. I feel like it's just like a win-win for win-win-win, like literally for everyone. Like it makes so much sense, and like it's nobody wants to be wasteful.
No,
Like no one wants to throw away, especially like you were saying, like a ton of medical equipment, medical devices, things like that are expensive, like, and you recognize like, okay, this is valuable, like this could be helping another facility, helping other patients, helping other people. So it's like, yeah, you definitely don't feel good about throwing that stuff away.
100%. And that's the biggest part for us is like when we go to reimbursements now, every facility is getting challenged with Medicare reimbursements going down and down and down every year. And unfortunately, the manufacturers continue to raise their pricing from this anchor to that anchor and the new widget and this and that. And obviously, it provides some benefit for the patients. But then the facility is sitting there trying to figure out how do we afford this? How do we balance the care of the patient, providing the best possible care and ensuring we're here in a year, 2 years, 5 years. And so that's what
Yeah,
we really try to work with the centers on is to make sure that we're able to help them with that and be
yeah.
consistent with a lot of their main items that they want.
For sure. No, that totally makes sense. And so, how did y'all kind of like come up with this idea? Because, like, I feel like it's something that I haven't heard a ton of people doing really on the market, even though it does make so much sense. And, like,
Yeah.
it seems like almost like an easy fix. It's like, how did y'all kind of come up with this? And, like, what? I feel like everything's born out of necessity. So, how did you kind of find this need in the market?
So unfortunately, I wish I could claim this idea. I did not. Our founder, Graham Whitley, he's the
Yeah.
one that started the company 10 years ago and kind of grew it into what we are today. But a lot of it from when I talk to him is hospitals will trade next door and they're like, oh, I need this. So they go to their neighbor or somebody in their group or surgery center and they kind of will help each other that way. But that's in the one off. And it creates a lot of logistical hardware and problems for that facility because then they have to remember, well, I gave you 5 of those, you gave me 3 of these, they cost that much, they cost the back and
Yeah.
forth. It's not an easy way to track it, and with inventory and with everything being aware of what the costs are now, you're like, why are we missing $10,000 in equipment? Like,
Yeah.
we loaned it out. That's not a good answer, right? So with us, we're able to go to that same facility and say, hey, we're going to buy it from A, bring it in house, inventory it, provide you reimbursement for it so you're taken care of, so you can show it on your books, and then we can go back to facility B and resell it for profit on our side. Obviously, we have to make some
Of
money. We're not a
course.
charity,
Yeah.
but we're able to do that from like Maryland to California now. It's not just right there. Like,
Yeah.
okay, we can go, from Main Street to First Street. We can go from Main Street to Santa Monica Boulevard.
Yeah. No, that's super cool. Yeah, it makes so much sense. Again, like, I mean, it's just like, I feel like probably so many hospitals need it too. And like, how are hospitals finding and facilities too, like you said, surgery facilities, really anywhere in the healthcare space, but how are people like finding out about y'all right now? Like, is it just like, okay, everyone's going to surgery stuff for this?
I wish I could say everyone go to surgery stuff. So honestly, everyone go to surgery stuff. Make our lives
Yeah.
easier. But a lot of it, honestly, is just word of mouth. We work with facilities.
Yeah.
Buyers will move to different centers. Google sometimes they're like, hey, I'm looking for this product. We'll come
Yeah.
up. They'll see us as an option within that. They call us and we'll do it that way. And a lot of times, a lot of our employees have worked with other facilities across the country. So we are able to make contact with those same buyers and introduce ourselves that way with a softer intro. Sometimes, hey, we are sales. We're going to pick up the phone and be like, hi, here's who we are, and here's my information, and let's meet and let's review more of what you're really going after and show you what we can help you and provide you the references for it. A lot of
Yeah.
facilities are concerned on the volume that they need. I'm like, we're not going out there saying, hey, we're going to be 100% volume on everything you do. But if you reduce 20 or 30% of your items by 20, 30%, you're saving 10% on that spend then. That's a big
Yeah.
reduction when you're thinking of the millions of dollars you spend on your products. And so we're looking at that little piece of the pie to help them just, that little break even, a couple dollars here, a couple dollars there, makes that difference for that facility to now be profitable and for the physicians
For
to bring
sure.
in more procedures, more patients, more support, more care services. It improves the entire cycle life of everything we do.
Yeah. Well, and it's like I feel like when you think about 10%, like if you're buying something for like say like $50, it doesn't seem like a lot of money, but like for a hospital that is maybe buying supplies for like $5 million a year, 10% is a ton of money, like, and it makes a huge difference.
Exactly. So, like, to your point, like, if they're buying it for $50 and we're able to provide it to them for $45 or something, and they're buying 100 of those, 1,000 of those in a year, all of a sudden that scale of numbers, and that's just one part. So imagine over the 30, 40 other parts that they're going to use that we can support them on, that's even greater reductions. And every hospital you talk to now, they're, how do we save money? Costs are going up, staff costs more, reimbursements are going down. The only place they have is on supplies. But a lot of them are locked into these contracts where they're paying more than their next door neighbors, or they're not meeting the volume that they need to meet to get the real discounts, and they're getting turned upside down. And so that's where we help them to save that money and to put it back into the patients.
Yeah, no, that totally makes sense. It's like they just need to find almost like a better way to do it where they can stock at a lower cost even if it's 10%, like, and
Yep.
10% like we were saying is a ton.
Yep.
And so what are kind of y'all's goals and objectives over like the next year or two? What is surgery stuff like really focused on right now with growth?
So for us, obviously, like just like every company, we are trying to grow. One of our biggest initiatives is we're trying to find new facilities to work with to acquire items from. Because obviously, like if we work
Okay.
with a facility, they know to call us, but we
Yeah.
don't work with every facility across the country. So we're trying to make more contacts and more inroads into those facilities, so we have a larger portfolio of disposals to provide back. Because
Yeah.
we'll get calls for one item and it goes on back order for a month. But if we have a stock, we're able to support our customers from that back order, and now our customers don't are not affected by it because we've
Yeah.
acquired and we've built up a supply to support them in that. So that's one of the biggest things we're trying to do. We're also looking at expanding ourselves outside of our current metro area of DC, looking at some other areas across the country to support our customers to provide faster delivery and faster
Okay.
response. A lot of times, some cases becoming merchant where, hey, it's Thursday night, they need something. Well, our only option is to ship it from DC. It's too late. But if we have
Okay.
something closer, hey, we'll get it to you Friday morning. We'll have a courier drop it off by 7 a.m. Physician's
Yeah.
happy, patient's taken care of. You're not delaying the case. Everything else then can proceed, and you're not causing any issues along that chain that needs to happen.
Yeah, no, that totally makes sense. That's super, super awesome. And I guess so like when you are reaching out to people and like they're becoming suppliers, like you're buying equipment from them, are they more likely to use you as a supplier to also purchase their stuff from?
So facilities initially are hesitant to work with us, and we kind of after they get to know us and they see what we're providing and understand the value that we're bringing back to them, they're more open to it and they're more engaged with that idea because they're like, "Wow, I'm saving $100. I saved $2,000 last year." I mean, we had one of our
Yeah.
customers that came to us and showed us their savings year over year, and it was $125,000 on those items that they saved by buying from us compared to another facility. And it's like
That's awesome.
that's an amazing part of savings that goes back and really affects that bottom line. And that was a surgery center. So if a hospital you think doing that, it's even further than that. A lot of the hospitals they want to stick with their contracts and things like that, but every contract they have has a variable component. They're allowed 10 to 20% variance away from their contract. And
Yeah.
if you buy 20% from me and you save 20%, that's a big savings on that part of it for you. And we're not adding to your steps. We're not creating more of a process for you. We're simply here filling the order that you already have.
Yeah.
So, and we don't have to train your staff. Like you don't have to have any adjustments to anything you do up in the OR.
Yeah. No, that's super cool. Why do you think people are skeptical of it? Just because maybe just because like it is like they like view it as not buying like directly from the
Yeah,
manufacturer kind of.
a lot of facilities are hesitant because there's obviously they have concerns on legality, they have issues on a variety of
Yeah.
different fronts. But that's when we sit down with them. We say like, express to us your concerns. We provide to them our documentation to show how we track it because everything we bring in, we know where it came from, when it came in, how it's transported, our inspection process to inspect it. From there, then we know where it goes, when it went. And even on a recall, we actually notify facilities usually faster for a recall than your manufacturer does. So,
That's
we,
impressive.
yeah, and we actually carry a larger insurance policy than a lot of the manufacturers do on their equipment. So
Wow.
we stand really behind everything we do on that part because not only does the end user have the manufacturer if something goes wrong, but they'll have us as well. So they gain an
Yeah.
extra kind of buffer layer in there as needed. It's really just kind of you drive a Nissan and you're like, oh, I don't know if I want to go drive a Toyota. Well, when you
Yeah.
start driving the Toyota, you're like, I like Toyota. Okay, this works. Okay, I'm good. It's just
Yeah.
getting them over that kind of initial part of it, and that's what my job is to help them understand that and see it.
Yeah. Help them understand, like, okay, you are safe with us, probably
Yeah,
safer than if you went directly as well. So
100%.
it's just, yeah, like it's just getting that point across and like helping them understand that. And then I feel like also, too, like the customer service aspect of that is so important as well. Like, and I feel like just from talking to you, it seems like you probably do a really good job of that as well with like just reassuring them, hey, like we're gonna be there, like we
Yeah,
got you.
and and it's wonderful for anyone can get on the phone and the email say like, oh, I'm gonna be there for you when you need me. Like, but it's shows up when you answer that email at 9 o'clock at night on a Friday. I mean, I had this list call me on Saturday at 11 a.m. They're like, hey, can you help us out? Hey, let's see what we can do. Let's have the conversation. But I'm there to provide that information and provide that communication because a lot of them it's like we don't know, and if you don't know, that's when the anxiety comes out. But if we're able to provide a path, provide a plan, and show it to you, okay, and we stick with it, that's when we gain your trust. And
Yeah.
that's the important part for us is to gain your trust, but to keep your trust.
Yeah, for sure. No, and I know you talked too about the surgery center that saved like I think it was like $125,000 dollars in a year, which is crazy. Do you have any other like really cool stories like that where you've talked to clients that are like, oh my gosh, we saved this much, you know?
I mean, I had one facility. They were buying an implant from a manufacturer, and the cost of that implant was so high they were not able to do that procedure at that center. So
Oh my
that physician
gosh.
and those patients had now to go to the hospital. Which, when you're in a hospital, you have a higher rate of infections. Like it's not the preferred spot if you can do it in a surgery center. The operating time, the pre-op time, the surgeon then has to stop his day to go over to the hospital to get that done when he could line up all the cases at the surgery center, do all the cases, and that patient all at the same time. So it's faster, easier, things like that. But when they started buying it from us, they're like, now we can bring the surgeon back to our center, do these cases here. We're not making money on it, but we're breaking even.
Yeah.
And now we make money from the other 5 cases he's brought to us. So now we've increased our revenue stream because you were able to provide this one case item.
Yeah.
So, like,
No,
those are
for
things we
sure.
really try to work on and understand from our centers.
That's super cool. Yeah, you guys are like working with them kind of directly to
Right.
like understand what their needs are too. And like I'm sure if you have a client and they're like, "Hey, like we're looking for maybe like this specific device," like would you guys go actively like seek that as well?
100%. 100%. And, like,
Yeah.
we do that all the time. Like, if a customer calls and said, hey, here's what we're looking for, we actually have our buyers go out there and they actively are calling and looking for those items for that customer. I
Yeah.
mean, I had a customer just last week. They were looking for a larger item because they had a larger patient coming in, and the manufacturer was out of stock. Like, we had a
Yeah.
case Saturday morning. We actually found it, and we were able to supply
Wow.
it for that case, and they weren't having to cancel it because otherwise they would have had to have canceled that case.
Yeah.
So
That's
that was the
super
big difference.
cool.
Yeah, and
That's
that's
awesome.
yeah. And Graham actually is the one that found it. He actually was calling around himself as the owner to find it. Like, it is truly like all hands on deck when we go off to go do this to help out.
That's so cool because it's also like a very unique experience with the fact that like with like a manufacturer, it's just like if you look online, they're out of stock, like they're out of stock, you know? And like with y'all, it's like, okay, maybe like let's see what we can do. We have some options that we can kind of like work with too. So that makes the working relationship, I feel like, just like different too in that
Yeah.
aspect as well.
And also for that same center, we actually saved them $100 per item on that. So they saved money and they were able to accomplish the case.
Awesome. That's
Yeah.
super cool. I'm sure
No,
that's like super rewarding too to see.
it is. It's, we try to, like everyone uses the words partner and stuff like that. And like, we really do try to do that with a facility at the end of the day. Like, if you tell us what your goals are, we can work with you to help you get to those goals. Because we obviously have our goals and your goals. And the true partnership is when we both win. So how do we
Yeah.
get to that point and have our both companies be winners at the end of the day?
For sure. No, that totally makes sense. Cool. Well, I loved hearing those success stories. I would love for you to tell everyone what is the best way to find surgery stuff online. I will also include links in the show notes too for easy access.
Appreciate it. Yeah, it's really simple. It's surgerystuff.com. And literally, we are stuff. Like, we have a variety of implants and anchors and meshes, everything that you're going to use in your OR there, we're going to be able to supply you with. So, surgerystuff.com, we'll get you connected. Let us know. Obviously, you can reach out to Taylor or reach out to me directly, LinkedIn or anything like that, and we'll make sure you get taken care of.
Awesome. That sounds great. Thank you so much. I really appreciate your time.
Taylor, thank you so much for bringing me on. I appreciate it.